Clinical pharmacy or clinical pharmacist. In fact, the role of clinical pharmacist in our country and definitely in abroad, it is recognized and it has to be recognized on a better scale. Clinical pharmacy is the branch of health science in which pharmacists provide patient care. Now, what do you mean by providing patient care? So look at the roles of a clinical pharmacist. Assuring rational use of medication. For example, why meropenem has been given to that patient? Why not ceftriaxone? Why not piperacillin tazobactam? Why is it meropenem? Why are you giving that particular medicine? Why can't you choose better alternatives? So that is called rational use of medication. And obviously the dosage adjustment, all these things also come under it. Reducing the burden on physicians on optimizing treatment strategies. Now, for example, it is a surgeon. Now, for a surgeon, it is very challenging because the job of a surgeon is very challenging. Because if you are not operating properly, then something else will happen to the patient. So already you have a huge burden on you. And then when the patient is shifted to the ward or the ICU based on the surgery, performed, you have an additional burden that you have to treat the patient with other medications. So you already have a burden of diagnosis, then you have to perform the surgery or whatever procedure it is, and then the pharmacotherapeutic burden also comes. So here comes the role of a clinical pharmacist who makes sure that the pharmacotherapeutic burden on physicians or clinicians is reduced. So for example, there have been a lot of cases in which clinical pharmacists have played a huge role in making sure that drug interactions are reduced to the best way possible. Adverse effects are reduced by proper monitoring parameters, and a lot of interventions have also been made. So basically, a clinical pharmacist is an integral part of a healthcare team.